Good afternoon, everyone, and welcome. I'm Jay Schnitzer from MITRE. Thank you for attending our MITRE Grand Challenges Power Hour entitled Launching an Apollo Mission for U.S. Biopreparedness. We have an exciting and packed agenda, so we will dive right in without delay. First, it is my great pleasure to introduce Congresswoman Lori Trahan, representative to the United States Congress, who will deliver some opening remarks. But first, a few comments about the Congresswoman. Growing up in a working class family in Lowell, Massachusetts, Congresswoman Trahan experienced firsthand the principles of sacrifice, hard work, and grit. Her father was a union iron worker and her mother a domestic worker who juggled several part-time jobs while raising her and her three sisters. The first in her family to graduate college, she earned a scholarship to play Division I volleyball at Georgetown University. Like many, she was introduced to public service as a college student in Washington, D.C. After completing her bachelor's in comparative and regional studies and international relations, she joined former Congressman Marty Mahan staff as scheduler, eventually working her way up to chief of staff. She deeply enjoyed working to serve the people of Massachusetts and was inspired by Congressman Meehan's leadership and resilience. She then moved to the private sector as the only female executive at a tech company. Her passion for bringing women into leadership positions led her to be a co-founder of the company, a woman-owned and operated consulting firm. She successfully ran for Congress in 2018 and currently serves as a member of the House Committee on Energy in Congress to help make healthcare more affordable, address climate change, protect kids online, and fight disinformation in our media. To further her ability to weigh in on these issues on behalf of the hardworking families she represents, she secured appointments to the subcommittees on health, consumer protection and commerce, and oversight and investigations. With the onset of the coronavirus pandemic, she rolled up her sleeves both locally and nationally to deliver health and support to U.S. citizens. Congresswoman Trahan, welcome. Thank you for joining us, and over to you for your opening remarks.
Good afternoon, and thank you, Dr. Schnitzer, for that gracious introduction. It's a pleasure to be here speaking with all of you today. I mean, since the very beginning of the pandemic, the critical personal protective equipment, reopening guidance, insight into equipment and medical supply chains, and data development to aid in COVID-19 therapeutics, you all have delivered as part of the COVID-19 Healthcare Coalition has made a tremendous difference in our fight against the pandemic. And I got to see your brilliance, your dedication, and your pragmatism up close on my tour back in July. As the pandemic shows little signs of slowing, I do look forward to the follow-up from this discussion on how we can continue to leverage this partnership to identify best practices and policies moving forward so that a pandemic at the scale of COVID-19 never happens again. COVID-19 has demonstrated just how unprepared we were as a nation for a global pandemic. You all have seen firsthand the insufficient response that forced healthcare workers, public health employees, and first responders to risk their own safety while they administered life-saving services. Meanwhile, lack of preparation has led to the loss of more than 700,000 Americans. I mean, a number beyond comprehension. We can never be caught flat-footed again. That is why I co-founded the Bipartisan Pandemic Preparedness Caucus, which focuses on strengthening America's response to the spread of COVID-19 domestically and how to better equip the United States in its fight against future pandemics. This includes investing in science, research, and medical technology, improving the nation's testing protocols and capabilities, investing in public health equity, investing in biodefense, securing our supply chains for medical and other essential equipment, protecting domestic and manufacturing capabilities, and improving international cooperation. I'd like to just spend a moment highlighting two bills among many that Congress should pass to address future pandemics: the Medical and Health Stockpile Accountability Act, which I will be an original co-sponsor of when it is introduced, and the Biopreparedness Workforce Act, which I'm drafting right now. I'm hopeful that both bills will be ready for introduction in the next couple of weeks. But a major barrier during the pandemic was the lack of downstream visibility into the exact quantities of critical medical supplies and drugs that were on US soil at any given time. As a result, there was a surplus of products in many parts of the nation, while places like New York City were operating in crisis mode and leveraging household products like garbage bags to protect frontline workers. The Medical Health and Stockpile Accountability Act will allow the Department of Health and Human Services to establish an automated supply chain tracking application that provides near real-time insight into the amount of critical medical and health supplies available in the Strategic National Stockpile, as well as the amount of supplies available in the medical and health supply inventories of state and local entities. The second bill I mentioned, the Biopreparedness Workforce Act, establishes the Biopreparedness and Infectious Diseases Workforce Loan Repayment Program to ensure an adequate supply of healthcare professionals engaged in biopreparedness and response activities. A major barrier to entry into the medical field is the massive amount of student loan debt that individuals acquire during their education. Given the spotlight that the ongoing public health emergency and available data has shown on our healthcare workers' preparedness needs, new targeted funding is necessary to fill the gaps that exist as we prepare for future pandemics and other public health crises. Pandemic preparedness is one of the most important issues that Congress has the chance to address at this very moment. And I'm pleased to share that both of the bills I just mentioned fit into the goals of the Bipartisan Pandemic Preparedness Caucus to prepare the nation for any future health threats. As a member of the House Energy and Commerce Committee and the Health Subcommittee in particular, I am in a position to push for policies that prepare our health systems and supply chains to properly respond to serious public health threats. Additionally, Congress is in the process of passing much needed and long overdue investments in infrastructure, expanded access to healthcare, affordable childcare, and more as we build our country back better than ever before. But I want to thank you again for taking the time out of your day to be here for this conversation. Before I jump, I just want to reiterate how critical you all have been through this pandemic. I plan to use my seat on the Energy and Commerce Committee to champion policies that bolster your ability to continue mitigating public health threats and delivering equipment and services to our country. Thank you so much.
Thank you, Congresswoman, and thank you so much for joining us, and thanks for getting us off on the right foot with this conference. We're very, very grateful. Deeply appreciate your comments, and thank you for your insights and your support. Next, it is my great pleasure to introduce Dr. Matt Hepburn, Director of COVID Vaccine Development in the Office of Science and Technology Policy, Executive Office of the President, who will deliver the first of two keynotes. But first, I want to say a few words about Dr. Hepburn. He's now Director in the Office of Development in the Office of Science and Technology Policy in the Executive Office, but most recently he was vaccine lead for Operation Warp Speed. Prior to that position, he served as the Joint Project Lead for Enabling Biotechnologies in the JPEO CBRND Defense. In this role, Dr. Hepburn was responsible for establishing a start-to-finish capability to develop vaccines and therapeutic solutions against future biologic threats. Due to the creation of this foundational capability, Dr. Hepburn and the Enabling Biotechnology team implemented the DoD Vaccine Acceleration Project, which provides key investments to advance vaccines and antibody therapeutic efforts, which, as we all well know, have paid off dividends greatly for us subsequent to that. And these investments also provided critical initial actions that set the stage for Operation Warp Speed. Prior to his assignment there, Dr. Hepburn served 23 years active duty in the Army, retiring as a colonel. His final assignment in the Army was as a program manager at DARPA from 2013 to 2019, where he served for almost 6 years and implemented numerous breakthrough investment programs to prepare for the current pandemic. These investments led to improved infectious disease forecasting, better diagnostics and medical care in resource-limited settings, and development of vaccine and therapeutic products. A significant investment in rapid antibody discovering and scaling was the pandemic prevention platform, aimed at discovery of antibodies and product into clinical trials in 60 days. These investments were applied during the current pandemic, leading to many of the current therapeutic antibody portfolios of investment by Operation Warp Speed and the Department of Defense. Concurrent with the first 2 years at DARPA, Dr. Hepburn also served on the research and development team of the new Research Development Acquisitions Directorate at the Defense Health Agency. He served in numerous other roles over many years of service, and I can't detail them all here, but just suffice it to say that back in the early days, he received his infectious disease fellowship and internal medicine residency training at Brooke Army Medical Center in San Antonio, and received his medical degree and undergraduate degree in biomedical engineering from Duke University. Matt is likely to ask you, the panel, you, the audience, questions and request input from you, the audience, during his keynote. If he does, please, and you have answers, please use the chat to respond, and we will collect those responses and give them to Matt. Now over to Dr. Hepburn for his keynote entitled White House Perspectives on American Pandemic Preparedness. Thanks for joining us, Matt. Over to you.
All right. Thank you, Jay. Thank you to Monique Mansour for including me. I mean, it's a powerhouse panel, so thank you to all of the panelists. And I thought we got off to a great, with our first presentation. I couldn't agree more, and it's a great way to start this powerhouse hour. I'm going to strike a note, a note of an optimism through the rest of my talk. But we need to start with 700,000 Americans lost their lives, far more worldwide, the pandemic of a century, and you know, it still affects all of us. We're not out of it. You know, every conversation we have about the pandemic needs to have a somber, reflective, very introspective approach, because we have to vow as a collective community to never let this happen again. And I think I welcome MITRE for holding this. This is why we're talking about it. The rest of my talk is going to be focused on some of the things that I think we learned through this process, and so that we can do better next time. And it's frankly a firm commitment on my part. I just started at Office of Science and Technology Policy. I got my badge yesterday, so fairly new to the role. But it's a personal commitment and obsession that I'm going to do everything I can so that nothing like this ever happens again in the United States or anywhere else in the world. And I think my panelists would agree. Probably everybody on the phone is making, or in this conference is making a similar pledge. I do feel slightly, cautiously optimistic that our government and that our nation and that our society is similarly committed. And I think our goal, probably a couple key messages, but the first is the opportunity that we see at Office of Science and Technology Policy is to harness the collective prioritization of this issue, that window, that opportunity where everybody recognizes how important it is that we do something, and really to harness the best, all of the energy and capability of our nation, so that it never happens again. End this pandemic as fast as we can, and then be prepared for the next one. Now, the flip side of that, I think, is that as we get better, there may be some things that happen along the way that not only allow us to transform our pandemic preparedness, but also to address fundamental issues in how we nourish and improve the health of our society, how we aim to achieve more equity in health and in how we interact and the type of society we are. There are transformative things that happen this pandemic that we need to capture and make sure become the new normal. And then our goal as we endeavor in pandemic preparedness is also to kind of catalyze some of those more general transformations. And I'll give you a couple examples. So my main message today, though, is we want to hear what you think. And so I think Jay put out this idea that we welcome feedback, dialogue, and we're trying to right now gather the best ideas in terms of what we should do. I'll be more specific. So the American Pandemic Preparedness Plan, we're calling it internally AP3, has been released publicly. It was released before I got on the job, but that's my mission, is that we are now, with this plan made publicly available, to execute the very ambitious goals of that, and to achieve them. The plan is a work in progress, and so there are some things in our plan that we probably, are maybe a little bit lower priority as we think about it a bit more, and there may be some things that we need to add that aren't there. And what we're doing right now, for any of those that ever served in the military, you're familiar with what's called the military decision-making process. Step 1, receive the mission. Step 2, mission analysis. And so we as a team right now are taking a look and going from here are the goals, exactly how we should accomplish it. I do think, frankly, I think it's great that we put this plan out there and it's publicly available. And so friends and colleagues have had a very low threshold and tell me what they think about the plan so far, and I love it. But that's our intent for this meeting, especially with this type of audience. And I think our MITRE colleagues have been gracious enough to gather your comments as we go forward. So I ask you to take a look at the plan, and if there's things you would add, tell us what you would add. The hardest part in mission analysis, and with a plan and with a mission as daunting as making sure pandemics never happen again, is what do you prioritize? And so that's the particular question I want to push on this audience is, we can survey, public health surveillance is important. Public health infrastructure is important. Being able to rapidly develop vaccines is important. There's a lot of things that are really important. I think helping us prioritize and helping us think through also what specifically can the federal government do from a leadership standpoint, from what can we catalyze through our effort and prioritization and resources that can give us that true transformation. I think the word we're going to use is transform. This is what we'll say. We've already, I'm day 2 on the job. I've been counting. We've already said transform. My team said it 87 times. But I am committed to that. And the reason I'm again optimistic is that there were some things in this pandemic that were truly transformative. And I had the privilege of a lifetime to serve on the Operation Warp Speed team. And vividly remember May of 2020, where it was no, it can't be done, and here are all the reasons. It's never been done before, and you can't develop a vaccine this quickly, and we were able to. I think during this pandemic, we highlight Warp Speed as an example. We have a lot of examples, though. There are a lot of examples of things that our government and our nation did that actually represented a substantial progress. In Operation Warp Speed, we always gravitate to the vaccines as our best example of product acceleration. But again, look at the multiple monoclonal antibodies that have achieved emergency use authorization. Those also, again, in record time. We have oral antivirals coming through the pipeline. I mean, there's been really a wealth of medical products developed for COVID in far shorter time than anyone would expect. That for us then becomes a new normal. And so, it begs the question, and I've gotten this question tons of times of, well, if you can develop a vaccine for COVID that quickly, and if you can develop that vaccine under the highest quality standards for safety, for efficacy. And the other part to emphasize is for transparency, with the data being published in peer-reviewed journals, with the FDA applications being publicly available, with public review committees at the FDA and CDC, so that the public can see what was actually done. And if all of those things can be achieved for a COVID vaccine, then why can't they be achieved for the host of diseases that plague us? beyond infectious diseases, or for global scourges such as malaria or tuberculosis. So we love those questions, and what we are profoundly excited about is making that type of product development the new normal, and therefore being ready for the next pandemic, but also having a substantial impact on health. There have been some other things too, and we're scratching the surface on this. And there's been a lot of dialogue about testing and diagnostics. I'm still pretty astounded that we can do over 1 million tests a day in the United States, and have fairly, we know about those results on a national level and are able to track that fairly quickly. So pre-pandemic, that would have been seen as, wow, that's an incredible capability that clearly wasn't there. Should we test more, and do we need more tests? Yes. But I use it as an example of another area where we've seen a lot of progress so far. And so then our charge is to make sure that we don't regress, and that we, for those areas where we have progress, that we sustain it. But then we go even further. So let me conclude on this. So back to this concept of transformation. And what I'm, I guess, most excited about, which I think is going to be how we can fundamentally be different, so that pandemics never happen again. The first is, I think, the relationship between the government and the private sector. And I see, Phyllis Arthur is on our panel, and I know that there's a lot of, we're going to continue to have this dialogue. But I think we've learned a lot during this pandemic of what the private sector can do. And what I hope that we have done well is to say that US taxpayer dollars investment have been worthwhile. And worthwhile meaning that they are investment that has led to something that has really helped us respond to this pandemic. And that has been achieved by a private sector entity, and that entity has essentially, that we've negotiated a contract of mutual benefit. I think that if we're in a situation where either the private sector or the government is getting all the benefit, it's not going to make sense in terms of that's not a partnership, right? We use the buzzword public-private partnership a lot, but I think what our future will look like if we do this right is those types of investments that really achieve mutual benefit. And I think that's a meaningful relationship going forward. And I think we as a government have learned a lot in the nuts and bolts of contracting and funding and being much more responsive, where I think we can nurture a biotechnology ecosystem that's going to be even better than it is right now. I think the second thing is making the point about meaningful medical products, which I've previously discussed, and again, being very excited about that as a new normal, but that we're not done either. So I think some of you have seen there's a lot of dialogue from Eric Lander and from our government and some of the other governments in the world, from the G7 summit, for example, announcing a 100-day goal for developing vaccines. Ambitious, yes, but we've been able to show we can go much faster. We, I guess, relish the challenge of seeing if we can go even faster. But it's always in light of never cutting corners or compromising safety and quality. So when we say we're going to have a vaccine in 100 days, that's meeting all of the highest standards in manufacturing and safety and efficacy, and everything that the American public and the world population would expect. The third is that I think it's come out this pandemic that we've had a lot of our greatest inspiration has come from people and disciplines that might not be usual in terms of infectious diseases and public health. And I think what we're profoundly excited about at the Office of Science and Technology Policy is this idea that as we nurture the next generation of scientists, as we think through how do we truly make science and technology more impactful for the American people, it's not just in the medical disciplines. And so the example we bring up a lot is in terms of cultural anthropology or behavioral psychology, certainly economics, AI and analytics and machine learning and all of those types of disciplines. I don't really care if you're the world's expert about COVID virology. What we do really care about is using your discipline to help us solve the problems for the future pandemics. And so I think that comes out in the AP3 plan, but I think it's a clear message from this, from OSTP and in terms of what we intend to do is we want to gain inspiration from the best minds in all disciplines in America so that this pandemic never happens again. My final word is a bit of a thank you. And I try to make a habit of this when I speak publicly about COVID-19 and especially on going back to my Operation Warp Speed experience. But, the reason we have vaccine is heroes. And it is thousands upon thousands of heroes, whether they worked in vaccine manufacturing plants, whether they were some of the literally over 100,000 volunteers that have participated in clinical trials so that we could develop these products, whether they were serving on the front lines at a pharmacy or at a local health department administering vaccine, or they were medical students that volunteered on vaccine clinics on the weekends. I mean, the vaccination of the United States of America took the efforts of hundreds of thousands of people, and every one of them is a hero. Every one of them has made a huge difference in this. And so as we are, again, very introspective and thoughtful about and solemn about the impact of this pandemic, let's not forget that there are great examples of heroes in America that made such a difference in making sure this pandemic wasn't worse. Thank you.
Matt, thank you. Thank you so much for a brilliant start to our session today. We have a couple of minutes, and so I'm going to take the liberty of the chair to take a couple of questions that I saw come through and paraphrase them a little bit for your consideration. One question was, how can the private sector best provide inputs to you for future policy? Is there a mechanism that you're setting up? Is there a channel? Is there some way that the private sector, if various entities have ideas for future policy, how do they get those heard or presented to you?
Yeah. So the first is I think we as a federal government strive to be that responsive. And I think for those of that served in the government, I think, that sometimes we are, sometimes we aren't, sometimes we're easy to get a hold of, sometimes we're not. I think I would put that though into a few different categories. I think for one, if you're part of this meeting, then send a note to Jay and Monique, and they'll get it to me. So let us know what you think. I think the second is that we do aim. I think the Office of Science and Technology Policy has traditionally done a pretty good job of convening, of bringing together experts, of getting, of seeking that feedback and having that type of outreach, so that we are kind of soliciting opinions and we're asking people what they think. I also think that in terms of the implementation of this pandemic preparedness plan, that implementation is going to come, across the federal government, and the aim is to leverage all of the best of the different departments and agencies, and a bunch of those good people, those public servants in our federal government, who are going to then say, okay, we're going to take the ball and we're going to run with it, whether it's better public health or data automation or things like that. A lot of those organizations actually have processes where you can submit your ideas. I'll harken back to my DARPA days. And with DARPA, which I think is a model for this, in terms of they have an open process where Basically, if you have a good idea and it's consistent with anything in the DARPA mission, which includes pandemic preparedness, you submit a 2-page abstract to their open broad agency announcement. I think our government's moving towards that. I think some groups probably maybe do a little bit better job than others, but I think that's one of the things we aim to do. So it's a way then you can formally review a really good idea from the private sector and put that into action. So, but we'll take it as a note. I think it's important to me, but what you really want to see is how we outreach, and I think we will prioritize that outreach. I guess my last point would be too is that we aim to be transparent, and that's why I'm here again to reiterate a point. I think it's great to make a plan public very early in the process, and I feel like that's what we did. And so, we want to stick to that very high standard of transparency so that you know what we're doing.
We have, thank you, Matt. We have maybe 2 or 3 minutes left. I'll ask a quick question that you might want to deflect because it might not be in your wheelhouse, but we got a question in about speeding up regulation, in particular about molecular diagnostics. Is there a way to streamline that kind of regulatory approval going forward? And I know it's not strictly within OSTP, but do you have thoughts on that, or should we?
I do. No. I'm happy to answer that, and I think I think we start to acknowledge that. I don't know if anyone knows anyone that works over at the Food and Drug Administration, but they've been on 24/7 for 18 months. I mean, those professionals have worked very, very hard on this pandemic. And there's been a lot of examples where the normal regulatory review time has been cut by 90%. And, in molecular diagnostics, I'm vaguely familiar, but I know that CDRH has received literally hundreds and hundreds of applications for various different COVID diagnostic tests, and has done their best to expeditiously review and provide clear guidance. I think in terms of transformation, though, I'm really glad that that's been highlighted, because I think our government would agree that that's an area that, when we can provide clear regulatory guidance, clear regulatory expectations, especially when it comes to next generation technology, that's very powerful. And that there are some really good programs at the Food and Drug Administration where they are trying to see what that next generation technology is and understand it, so that they can provide clear guidance early in the process. And that theme, in terms of how we assist the FDA, and there's a lot of ways you can do this. Some of it's professional development and training and encouraging, just like the military does, is sort of nurture and develop military leadership, across our government and in the FDA, training those professionals so that they're really competent in understanding the technology, and but there's a lot of other areas where I think AP3 and these types of efforts can really assist the effort in that daunting task of being as forward-leaning and providing as much clear guidance as possible.
Thank you, Matt, and thank you for your leadership. Well, thank you for your talk today and for being with us, but thank you especially for your leadership on all things related to this, not only now, but in the past. And you mentioned heroes, and I would just, without trying to embarrass you too much, I would say all you have to do is look in the mirror and you will see yet another hero. Thank you so much for everything you do. Next, it's my great pleasure to introduce our second keynote speaker, Dr. Richard Danzig. Dr. Danzig probably needs no introduction, but I'm going to do one anyway. Richard is a senior advisor to the Johns Hopkins Applied Physics Laboratory, a consultant to the Intelligence Advanced Research Projects Agency, chair of the advisory panel for the Idaho National Laboratories Innovation Center, and a member of the Toyota Research Institute Advisory Board. He is also a member of the Defense Policy Board, the President's Intelligence Advisory Board, and the Homeland Security Secretary's Advisory Council, as well as a trustee of Reed College and of the RAND Corporation. In recent times, he's been a director of the National Semiconductor Corporation on the New York Stock Exchange and the Human Genome Sciences Corporation. He has also served as the chairman of the board of the Center for New American Security, vice chair of RAND, and chairman of the board for the Center of Strategic and Budgetary Assessments. Dr. Danzig served as the 71st Secretary of the United States Navy from November 1998 to January 2001. He was the Undersecretary of the Navy between 1993 and 97, and from the spring of 2007 through the presidential election of 2008, he was a senior advisor to then Senator Obama on national security issues. He's a member of the Aspen Strategy Group and has served in recent years as consultant to the Departments of Defense and Homeland Security on national security issues. He has received in the past a BA degree from Reed College, a JD degree from Yale Law School, Bachelor of Philosophy and Doctor of Philosophy degrees from some place called Oxford University in the UK, where he was in fact a Rhodes Scholar. Upon his graduation from Yale, Dr. Danzig served as a law clerk to then US Supreme Court Justice Byron Wright. Over to you, Mr. Secretary, please, for your keynote entitled, "We Are Not Alone, Pandemics Amongst Other Preparedness." Thank you, Richard.
Thank you, Jay, particularly for that fine introduction. Astute listeners to this introduction will note that most of my achievements, such as they are in the past. And I must say, I had reflected after these first two speakers, how in this power hour, you're seeing a steady descent in power from the Congresswoman to the director in the White House, to someone who doesn't even have a badge, me. But I think my role is to try and cast light on some of the questions we're talking about from the perspective of someone who's not right in the middle of it at the moment. And in that context, I want to take as my theme the notion of preparedness, not just for the next pandemic, which the Congresswoman so aptly emphasized as just a central issue and which Matt is focusing on every day. But a recognition that in fact there are parallel efforts being made for other kinds of preparedness that for other people are every bit as central as the one that we focus on. And that the cross talk, the interaction between the biological problems and these other problems is important and can be instructive and has messages, I think, for all of us. So let me take as a couple of examples the discussion now going on about US industrial policy and, for example, the enrichment of American efforts to design and produce semiconductors so vital to all of our commercial activities and our military activities. And let me take the example of cybersecurity, which you're all well aware, most recently from the ransomware attacks, which also has then generated extraordinary effort to be prepared in these contexts. And what I want to do is line these three up next to one another and say a little bit about, as I say, the crosstalk. The first thing that's striking to me is that we all very much articulate the proposition that we shouldn't fight the last war. Everybody subscribes to that. We understand it. And we then move out to implement this proposition by saying, we're going to prepare for the next pandemic, whatever it might be. But I would make the point that in focusing on a pandemic, we are focusing on the last war. And it's worth thinking more broadly about this problem. If, for example, in December of 2019 and over the course of 2020, we were coping with a major earthquake in California or a nuclear accident or a cyber disaster, the destruction of our power grid, we would all now be talking about earthquakes and nuclear accidents and the destruction of the power grid, and we would not be talking about pandemics. So it is worth noting that we are so influenced by the catastrophes we've just been dealing with that we tend to be blinded to other problems, even when we are out there saying we are not going to fight the last war. We define war, if you will, within a kind of limited parameter. This has, I think, implications, though, that transcend simply the notion of broader thought, because it is, as a practical matter, a reality that we know that if we design narrowly for a particular problem, in this case, even a broad problem like our future pandemic, the nature of our body politic and of our public is such that we wind up over time losing support for this goal when it turns out that the next pandemic doesn't occur or whatever. Think about, for example, the reactions to terrorism after 9/11, to pick an example just within recent time. We will steadily lose the energy now associated with countering the next pandemic. And to the degree that we are successful in forestalling future pandemics, we will lose it more. One of the implications for me about this is to design broadly. The ways in which we construct our capabilities in response to this pandemic, the structures that we develop, receive nourishment through things like the budget and our psychological energy and our political commitment every day, to the extent they're broad and applicable to other things, and risk becoming anachronistic and limited to the extent they don't. So it's important, I think, to gain the sustenance we can gain from thinking more broadly about a range of problems across a range of topics, in order, among other things, to be successful on the very one that we think, in this case, pandemics, is particularly important. I'd note also that even within the field of public health, there are things besides pandemics. If, to pick a different example, antimicrobial resistance had manifested itself in December of 2019, we'd all be talking about AMR, and we would not be talking about pandemics. So to what extent does what we build against the future pandemic protect us against AMR seems to me an obviously central question for our profession. Against that backdrop, I want to make 3 points about the ways in which we're responding to the multifaceted demands for preparedness in my examples, the context of cyber, semiconductors, and biological or viral pandemics. The first is that they actually all present the same problem in one important dimension, and it's the first one that Matt began talking about, which is the relationship between government and the private sector, and the ways in which we work together and harness the private sector. We have seen in the context of cybersecurity that the critical tools are in the private sector, the software companies, et cetera, just as we've seen that in the context of our pandemic thinking. In the context of the semiconductors, obviously, the major corporate powers that design not only semiconductors, but semiconductor tools are critically important. In all these areas, also all three, we have important questions about our relationships with our allies, about supply chains, about the location of dependencies that are common to all these areas. But just focusing on the question of the relationship between the national government, our national government, and our private sector, what's striking is we had one remarkable achievement, and Matt Hepburn was central to it. We're all extraordinarily appreciative of it, and that's Operation Warp Speed. But what we did to achieve that, and I think Bob Kadlec had a central role in this regard, was to bring in an executive from the private sector, Moncef Slaoui, who had a range of talents derived from his skills in the private sector that enabled him to bridge from the public sector to the private sector. And I think when we talk about heroes, I'll put Moncef, I expect Matt will, right up there in the first rank. But that phenomenon of bringing people from the private sector and the business community into public government is extraordinarily rare. And if Matt's proposition is right, that we need to create a new normal, I would suggest to you that in all these areas, the new normal has to be one that involves a combination of government kinds of skills and private sector skills. And that suggests a broader range of considerations that in fact are applicable not just to pandemics or semiconductors or cybersecurity. They involve things like the government's normal practice with respect to conflict of interest, the way we contract, a subject that Bob Kadlec pioneered with dealing creating BARDA, but that we need to think much more about, and in general, how we build cooperation. NSA, for example, the National Security Agency, has done some of that with the private sector on cybersecurity. We need to learn from those models, and we need to push a much more general point, in my opinion, about public-private cooperation. Matt used the phrase, quite rightly, a public-private partnership. We need to think about public-private partnership as a generic phenomenon and learn, take the lessons we've learned from pandemic and apply them in these other areas. And the lessons we've learned in these other areas, as for example, from the NSA, systems of private-public cooperation to this area. As another example, unconnected to these, but clearly representative, I pointed out recently that when the Federal Aviation Administration regulated and collected data on the aircraft accidents, they were not empowered to collect data on near misses, but they understood that near misses were quite as important in their implications as actual accidents. And they had to come to grips with collecting that data from the private sector, but the private sector resisted providing the data. And that resistance was in part because they were afraid of the regulators, and in part because they had intellectual property, that is to say, insights that they wanted to retain for themselves, and partly because they were afraid of reputational consequences. And what was done was that a nonprofit entity was created that had a board which consisted of the airlines and the FAA, and that nonprofit entity collected data and anonymized it. So the government got the benefit of a large data, pool of data, but the private sector felt that it was provided on protected terms. So this is an example of working to cross the divide, that we need more of these kinds of things. And it brings me to my second point, which is an amplification again of one that Matt made, which is about data. When we look at what is happening out there, one of our biggest problems is that our federal apparatus doesn't have good access in a timely and rapid fashion to the private sector data. That the number of hospital beds, et cetera, that are available, the numbers of ventilators and so forth, all are exceedingly difficult to track. And then of course, the incidence of COVID cases and so forth. And this is a similar kind of issue that arises in the context of the cybersecurity issues. In fact, it even arises in the context of the semiconductors, where the government has very great difficulty figuring out what mergers to approve or what not, what purchases, what investments, and how to use the large pool of money that's now being created to allocate it wisely across the industry. We need ways of developing data and anonymizing it, as in the example that I've just given, that enable us to move forward. And this is a generic problem. It's not just a medical public health problem. And when understood generically, we begin to find the solutions from other areas, but we also recognize that the kind of solutions we need are across all of the government and not just in this area. And as a third and last example, I point towards the obviously related question of our ability to analyze this data and to act and develop programs that are active in this regard. I've suggested previously that MONSEF's presence was extremely important. I would argue more generally, the federal government has shown that it can, if not do science, and sometimes it does it extremely well, it can comprehend it. We have experts who, if not at the exact level of the heads of R&D for drug companies or for semiconductor companies or cyber software companies, Nonetheless, the government expertise from our national labs, from places like DARPA, from NIH, et cetera, can keep pace. But on the business side, we don't have that. The federal government does not, by and large, have in its ranks people who have the kinds of skills, knowledge, analytic capabilities that people in the private sector need. And yet that's fundamental. When we look, for example, as MITRE has contributed significantly, and I point to Jay's work and Monique Mansoura and others, when we look at the history of the relationship between the US government and the major pharmaceutical companies, it's a history marked by a series of miscarriages. And those miscarriages arise when, for example, we support the development of an Ebola vaccine, push the companies to act with priority, and then when Ebola diminishes, we withdraw that kind of support and create distrust and lack of commitment as we move forward. We've replicated that phenomenon again and again in different areas of government. And the result is that in many areas, we have great difficulty comprehending the business imperatives of actors in the private sector and finding ways to achieve synergy between those imperatives and the national priorities. So here we need to build a federal workforce that has a degree of richness which our present workforce is relatively starved of. And that involves a whole lot of investments in the federal workforce and in the relationship between that workforce and, of course, the business community and others. And this involves crosstalk in ways that are now wildly inhibited by our regulations and our arrangements. So I would suggest my talk begins with the proposition we are not alone when we think about the need to prioritize better activities so as to avert a future pandemic. We are not alone because other people are struggling with analogous challenges. And when we look at those analogous challenges, we learn that those other people are in fact making some progress in some areas that we can learn from. My FAA example, my National Security Agency example. And they are dealing with problems where we can be instructive to them, as for example, we were through the achievement of warp speed. But above all, if we try and solve these problems piecemeal, we're in effect like fingers of a hand, each trying to lift up the problem with one finger, when in fact the problems of conflict of interest, the character of the federal workforce, our sharing and anonymizing of data, are problems that need to be grasped with all the fingers of both hands if we're possibly going to get our, so to speak, our arms around it. This metaphor may not exactly pass duty muster in a public health context, but I think its thrust should be clear. So what I'm trying to suggest is, let's not just fight the pandemic war and ignore the rest. We could give other kinds of examples as, for instance, our difficulty in putting one federal agency in charge, something that we managed not to do with respect to terrorism. DHS is just the coordinating agency. Something we managed not to do with respect to pandemics. HHS is a coordinator, but has no authority over the other agencies, et cetera. We need to rethink the structure of the federal government in this regard and its relationships with state and local governments, and recognize that the problems of the future may be very much instructed by our experience with this pandemic, but they may, indeed probably will not be the same. And even if they are the same, if we're really going to understand them, we need to think about them more broadly than we usually do. We're not fighting the last war when we think about pandemics more broadly, but we're conveying, in my opinion, too limited a notion of war. Some things we will need to do with great particularity. What's in a national stockpile for pandemics is different from the tools we use for cyber. But the broader kind of thinking is, I think, valuable. And so I want to urge it on this audience, which is composed of so many people who are so important to our thinking, and suggest that that broadening can enrich us both on the broader challenges and on the particular one that we all care so deeply about. So that's my message for today, Jay.
Thank you, Richard, for such eloquent and lucid insights and thoughts to help us broaden our imagination about how to approach this, and reminding us not to fight the last war, even though that is indeed our inclination, despite our saying otherwise. In the interest of time, we're going to move on to the next phase of the Power Hour, and that is our illustrious panel. And I'll start by introducing our three panelists. First, I'd like to mention and introduce Phyllis Arthur, who's Vice President of Infectious Disease and Emerging Science Policy at the Biotechnology Innovation Organization, BIO. In her role at BIO, Ms. Arthur is responsible for working with member companies in vaccines, molecular diagnostics, and biodefense on policy, legislative, and regulatory issues. Ms. Arthur joined BIO in July 2009 as the Director of the Healthcare Regulatory Affairs. Prior to joining BIO, she worked in numerous marketing and sales positions for Merck & Company Incorporated in their vaccine division. Over her 16-year career in vaccines, Ms. Arthur launched several exciting new vaccines in the United States and internationally, including the first HPV vaccine. During her years in marketing, she worked closely with clinical and academic thought leaders in infectious diseases, oncology, and public health. In addition, Ms. Arthur also led a large vaccine sales organization of over 75 representatives and managers covering 14 states. Before graduate school, Ms. Arthur worked as a research assistant for two economists at the Brookings Institution in Washington, D.C. There, she conducted economic analyses related to savings and investment policies for the OECD countries. Ms. Arthur received her BA in economics and international politics from Gaucher College and her MBA in 1991 from the Wharton School of Business at the University of Pennsylvania. Second, I'd like to introduce Dr. Julie Gerberding, Chief Patient Officer and Executive Vice President for Population Health and Sustainability at Merck. As Chief Patient Officer and Executive Vice President, Dr. Gerberding is responsible for patient engagement, corporate social responsibility, and other functions. Formerly, she oversaw global public policy and strategic communications for the company. She joined Merck in 2010 as president of vaccines and was instrumental in increasing access to the company's vaccines to people around the world. Previously, Dr. Gerberding was director of the U.S. Centers for Disease Control and Prevention, where she led the CDC, where she led the agency through SARS and more than 40 emergency responses to public health crises. She serves on the boards of Cerner Corporation and MSD Wellcome Trust, a nonprofit that delivers new technologies for developing countries. She serves on the executive committee of the aforementioned Biotechnology Innovation Organization, BIO, and co-chairs the CSIS Commission on Strengthening America's Health Security. She received her undergraduate and MD degrees from Case Western Reserve University and a Master's of Public Health at the University of California, Berkeley. She completed her internship and residency in internal medicine and fellowship in clinical pharmacology and infectious diseases at the University of California, San Francisco, where she is still currently an adjunct associate professor of medicine. Thirdly, I'd like to introduce Dr. Robert Kadlec, former Assistant Secretary for Preparedness and Response in the Department of Health and Human Services. As the Assistant Secretary for Preparedness and Response, ASPR, in HHS, he was the Secretary's principal advisor on matters related to public health emergencies, including bioterrorism. Dr. Kadlec spent more than 20 years as a career officer and physician in the United States Air Force before retiring as a colonel. Over the course of his career, he has held senior positions in the White House, the U.S. Senate, and the Department of Defense. Most recently, he served as the Deputy Staff Director to the Senate Select Committee on Intelligence. He previously served as Staff Director for Senator Richard Burr's Subcommittee on Bioterrorism and Public Health. He also served in the White House from 2002 to 2005 as Director for Biodefense on the Homeland Security Council. And he served as Special Assistant to President George W. Bush for biodefense policy from 2007 to 2009. Earlier in his career, he served as a Special Advisor for Counterproliferation Policy at the Office of the Secretary of Defense, where he assisted DoD and efforts to counter chemical, biological, radiation, and nuclear events in the wake of 9/11 and contributed to the FBI investigation of the anthrax letter attacks. He began his career as a flight surgeon for the 16th Special Operations Wing and subsequently served as a surgeon for the 24th Special Tactics Squadron and as special assistant to J2 for chemical and biological warfare at the Joint Special Operations Command. He was named U.S. Air Force Flight Surgeon of the Year in 1986. He holds a bachelor's degree from United States Air Force Academy, a doctorate of medicine, and a master's degree in tropical medicine and hygiene from the Uniformed Services University of Health Sciences, as well as a master's degree in national security from Georgetown University. So we have an amazing panel, and I'm going to start, please, with Phyllis. So Phyllis, from industry's perspective, what is needed to make all of this work going forward, in your opinion? Please, over to you.
So Jay, first let me say I'm so excited to be here. What a fantastic set of remarks by both the Congresswoman, by Dr. Hepburn, and certainly Dr. Danzig. Very impressive. I took about 10 pages of notes, and I hope the audience did as well. I think it's great that we're talking about this in this Apollo mission approach. I think it's been a common theme. We saw it with the Bipartisan Commission on Biodefense earlier this year, and also in the OSTP paper. And so I think I want to cover a couple of overarching issues from the industry perspective in answer to your question. I think that what industry really needs is to have that clarity of leadership, communication from the government partners, and some level of commitment to provide levels of certainty that are hard to get in a space that's as uncertain as medical countermeasure preparedness. So leadership, communication, and certainty. And it's really important for this because we're talking about medical countermeasures. And actually, as was said earlier, the pathogens may come and go. We see them blow through, and we all galvanize and work on them, and then it falls away and there's no path forward, or they could unfortunately go to a full-blown global pandemic like we saw with COVID. And so the things we can do within that partnership that help give some level of understanding of how we will go from one stage to the other and what the outcomes will be in each of those stages are really important. So thinking about the structure of this Apollo mission in that sense of true public-private partnership really can help industry explain how they can be involved in this space to their leadership, their stakeholders, their shareholders, and their investors. And it's really important, and I think Dr. Danzig said this really well, for the US government partners to understand this much maligned but often used term by industry, this issue of opportunity cost, and how companies make decisions and how they build and therefore build systems that reduce or actually share in the partnership sense, share the risk of the development, the manufacturing, and the execution of the products. Given that we really have an increased need to sort of think through what we mean by partnership. It really means respecting the different skills around that table and leveraging them in the broadest possible way. So the biopharmaceutical industry is comprised of people who understand not just drug development and drug manufacturing, but also how they're used, how people think about them, how to make sure we do the research in a certain way. How can we leverage the expertise, experience, and assets, both human and physical, of the companies to get the maximum success out of the undertaking? And I think that part of the benefit of the structure of Operation Warp Speed was it really was based on that respect of the different skills across all the different players at the table, including the private sector. The government really owns the strategy in the MSAM space. So what pathogens we'll focus on, what approach are we going to take? You know, what's the order and sequence of diagnosis, treatment, vaccination? How do we leverage and share data? But a lot of the expertise on how to deliver on that really sits with industry. And I don't just mean from research, I mean all the way through administration, distribution, administration, implementation, having that full end-to-end view and including industry in that will be really successful. So we really need to understand the strategy, not just for the first wave of products, but also what comes after. So how will new technologies roll into the strategy and how will we manage that during peacetime? And then certainly as we execute our response in an emergency. I think obviously we all talk about the funding, but it's good to understand how the resources will be allocated across the entire end-to-end activity. So there's various product types. You have vaccines and diagnostics and therapeutics. You have various stages of development. What do you do with early products or late? You have all these different kinds of platforms. And I think the success of investing in multiple types of platforms because of preparedness probably allows us to go faster when we get to an emergency. How are we going to approach supply chain and manufacturing scale up? These are the kinds of strategic issues industry wants to hear delineated and see the funding in the right buckets across the US government. So maybe there's certain money in NIH strategy for early development, but that's actually one of the less expensive things we do across multiple pathogens. There needs to be the right funding in, say, BARDA and ASPR or DoD to make sure there's money for the more expensive parts of the process later on. I think in particular, if we're going to do this, really try to hit this 100 days goal for vaccines, and also I think the other urgent goals for investing in pathogen families for antivirals and monoclonal antibodies, we need to understand where those funds are going to be. And we're going to have to really invest in novel platforms in this interpandemic period when we get to it, such that we have a host of platforms ready to go in phase 2 or 3 as soon as we can. And that means a clear, uninterrupted strategic vision of the funding and a clear way for companies to engage on this and really have that worked out across the FEMC. I think, I'm sorry.
We're going to have to wrap up.
Sure.
In a moment, if you would, please.
Sure. I'll say the last thing, which I think is most important for industry. We have to guard those things that industry holds dear, which is their skills, their intellectual property, and their know-how, such that you can have that sustainable activity between small, medium, and large companies all the way through. Thanks.
Thank you so much, Phyllis. Great input, really great input. My next question is for Bob Kadlec. Bob, history will undoubtedly remember and record Operation Warp Speed as a once-in-a-lifetime kind of success. But how do we make sure we are able to do this again and again, not just this once? Over to you.
Jay, thanks for the question. And again, like Phyllis and the others, I'd just like to acknowledge the sage words by Secretary Danzig, Matt Hepburn, as we open this session. But here's the point, though, is that there is no limitation to the possibility of doing this over again and over again. I think the key thing here, and it's been mentioned by several of the speakers already, it's this idea that it's really bringing the best of government together. And when I say government for Warp Speed, it was the Department of Defense and HHS. So in the pantheon of heroes, I would add Gus Perna, the 4-star general logistician, as being one of them, and Carlo Di Notari di Stefani, who was, again, part of the civilian contribution and understanding the manufacturing landscape in the commercial sector. That's one critical thing. And then most importantly, and to Phyllis's point, it is really about the public-private partnership. That partnership can't start when the crisis happens. And in fact, I think it pre-existed in part, though imperfectly, before that. And I think Richard Danzig's comments about the failure or near failure of Ebola was kind of highlighted to the fact that, yes, we did start a process and we did leave suitors at the altar. And I just acknowledge Julie on the line here, that in the end, it was Merck's product that ended the Ebola crisis of 2016 to 2018. But yet it was something that started in 2014, and there were significant opportunity costs that were lost because Merck did the right thing as a public servant in America and a global citizen by stepping into the breach and not only once, but twice coming in to solve that problem. So I think with Warp Speed, it's really about building that long-term relationship between the government, between the private sector. And here's a couple other things that I would just ask. The secret sauce, I think that was mentioned here, was expert decentralized command and control of the program that involved ruthless coordination, portfolio management, and decision-making. Now, First of all, the government didn't have the expertise in this domain. It was in the private sector and was really working to enable the private sector to move at the speed of science, to remove the barriers, both logistical and contracting and resourcing, de-risking activities in a way that fundamentally just kind of made things go seamlessly forward. Now, I would also point out to you that the Defense Production Act, not yet mentioned so far, played a significant role in that, not by directing companies to do anything, but enabling companies to do what they needed to do to advance their products forward. So those are the kinds of things. The other side of this is really about the coordination factor. And Phyllis mentioned about FEMC, Public Health Emergency Medical Countermeasure Enterprise. That was the model for Warp Speed. That was the thing that said, how do we functionally bring everybody together to align, synchronize, and execute the role of preclinical, clinical, manufacturing, and distribution in a way. Now, we look at this, and I think Richard Danzig's point is the right one, to say, well, somehow that's just limited to the area of medical countermeasures. That is not the case for pandemic preparedness. I would argue, and we have examples in surveillance, with testing, with healthcare, with hospital healthcare, with not only medical countermeasures, but in the supply chain, that it was really that public-private partnership that allowed us to really execute in a variety of dimensions in a way that we never did before. And quite frankly, if we're not careful, we're going to lose that memory, that muscle memory to do that. But I'll just reemphasize one point as a last point. This public-private partnership has to transcend before an event, during an event, and most importantly, after event, to do the lessons learned, to build on that, to trust the investments, and quite frankly, the coordination that is required to deal with this, because quite frankly, to do this in 100 days, you're going to have to start 3 years before the pandemic, as we did with Moderna and with other products, to basically set the foundation. And again, we can't screw our partners. The people like Merck who came to the call, the companies like Moderna, big and small, who said they were going to do this not only for their country, but for the global benefit. And so that's what it takes to make it work. And I'm convinced we can do it again. We just got to keep our eye on the ball. Thank you.
Thank you, Bob, for your incredible insights here. I will say two things. One is, one theme that's come across clearly in all of these conversations is the importance of trust, and you just re-emphasized that, Bob. And the second is that on any list of heroes from the last 2 years, no list would be complete without your name on it. So thank you for all you've done for us. We really appreciate it. Next, I want to go to our colleague, Dr. Julie Gerberding. Glad you're with us, Julie. Thank you for joining. I know you've had a busy afternoon yourself. My question for you is, you've spoken clearly and eloquently, and I've heard you in the past, about our collective failure to learn from past events, despite having a shelf full of after-action reports from these with clear findings and recommendations, which demonstrate about 80% concurrence among them. Yet essentially none of these recommendations have been successfully enacted over the years. How do we ensure that this time will be different?
Thank you, and thank you so much for letting me participate in this incredible conversation. I'm sort of the wrap-up speaker here, and probably have a little to add to the erudite comments already made. In November of 2019, the CSIS Commission on Strengthening America's Health Security issued a report that was basically entitled "Ending the Cycle of Crisis to Complacency." And it was a reflection of what you just said, Jay, the multiple after-action reviews and a side-by-side analysis basically saying the same thing over and over again: leadership, strategy, multi-sector engagement, unity of command, and probably most importantly, sustaining the investments and the capacity development necessary to truly move the needle on the dial. But I'm also struck by something that Richard said about not fighting the last war. And I think I'm a strong believer in after-action reviews, and that if we have another SARS-CoV-2 pandemic in a couple of years, we'll probably be pretty prepared for it but that doesn't really help us with all hazards or all hazards plus if we want to include semiconductors and cybersecurity in that equation. So one of the things that I asked myself in November of 2019, before this pandemic emerged, was when has this ever gone right? When in our government or in anybody's government have we achieved a sustained investment in solving something really hard or really challenging? And just kind of ironically that this program is focused on the Apollo mission, because I think there are some aspects of the Apollo mission that are germane to the sustainability. We don't need to rehash what happened in landing a man on the moon, but I think the principle of taking advantage of a nation that woke up to a perceived threat, that the Russians are coming, and really galvanizing that enlightened self-interest at a societal level into a very expensive commitment. In today's dollars, I think the figure is just south of $300 billion for the lunar landing mission. So a tremendous scale of investment that was unprecedented for something like that at the time. I think also there was the recognition of a sole purpose, land a man on the moon and bring him back. But at the same time, there was a recognition that we were going to grow, kind of crawl, walk, run our way there, and that there would also be collateral benefit from making these kinds of investments that were unpredicted, but would serve us well in other domains of science or national security, et cetera. The other aspect of this, and if you go back and try to understand how the money actually evolved for the Apollo mission, it wasn't always a secure investment, but basically when the money was needed, the money was available to prosecute the advance of that mission at scale. And we need to really look at that particular dimension of this, because I think one of the reasons our sustained effort fails is, of course, there is this strategy, there is the unity of command and the structural decisions about where in the locus of our government does the accountability for the planning and the execution of this ultimately get coordinated. But I think the sustained investment is the most troubling aspect. Particularly in the biohazard domain, where we are funded on discretionary dollars or emergency dollars in the setting of a crisis, and in the same hopper with all of the other discretionary funding. So if something doesn't score well, it's very difficult to continue it going forward. We also don't fund preparedness at the scale that would come anywhere near meeting the laugh test for what's necessary to be successful. So I think if we want to really be better prepared for the range of threats, recognize that we do have some really serious, hard conversations that need to happen in our government, both in legislative and the executive branch. But we also need to prepare ourselves for a very different model of investment. I happen to think that the DoD brings a lot of learning to the table here, and not just General Perna in the warp speed, or General Honore during Katrina, or whoever, the military person who came in the middle of a crisis to try to get things straightened out, but rather that whole model of strategy, intent, executive and broad leadership development over long arcs of time, and then a budget mechanism that allows the macro investments to be made and not second guessed every single year in the middle of a national defense initiative. So I think it's a heavy lift for where we are financially as a country, and certainly where we are in our polarized and environment of distrust. But we've got to have conversations about how do we pull this together in a way that allows us to truly invest in a preparedness paradigm that is commensurate with the scale of the threats, not just bio threats, but the scale of the threats to our national security, which this indeed has been, that we will likely continue to experience going forward. If we haven't learned our lesson this time, I fear we never will.
Thank you, Julie. Heavy lift indeed, but we don't have any choice. We've got to make it happen. So thanks for giving us the guidance on how to do it. Greatly appreciate it. So we've come to the point in the power hour, or power 90 minutes, where we will kind of have to wrap this up. And you're probably wondering how we're going to pull all this together. And so I've got a secret weapon. I'm not going to do it. I'm going to rely on my friend and colleague, Governor Mike Leavitt, to do so. Just a couple of words of introduction, because I don't want to tie up too much of Mike's time. Michael Leavitt is the founder of Leavitt Partners, where he helps clients navigate the future as they transition to new and better models of care. In previous roles, Governor Leavitt served in the cabinet of President George W. Bush, initially as administrator of the Environmental Protection Agency, EPA, and then subsequently as Secretary of Health and Human Services. And he's also was a three-time elected governor of Utah. His career has been distinguished by many, many things. I'm not going to cover all of them, except to say that a pattern of innovation runs throughout Mike's career. When he was elected governor, for example, Utah's major freeway system was dangerously inadequate. Taking what some thought was a significant political and financial risk, he instituted a design-build system, creating cost and quality incentives between the state and its contractors. The project was finished in half the originally protected time and well under budget. Collaboration is a word that comes up repeatedly when you look at his background, and I can speak with personal experience that is absolutely true over and over and over again. And then finally, he's a seasoned diplomat, having led U.S. delegations to more than 50 countries. So without further ado, I'm going to hand it over to my friend and colleague, Governor Mike Leavitt, to try to wrap this up for us in a nice little bow. Mike, over to you.
Thank you, Jay. And I join with all of those who have commented on the quality of this offering. And thank you to MITRE for organization of it. In the closing moments, I would simply like to make 3 points. The first is, it has become evident through history that we struggle as a nation to maintain an interest in preparedness. And I'd like to offer a suggestion as to why that is. It is because human nature is the enemy of preparedness. We always discount risks that are not directly in front of us. The second point that I'll elaborate on all of these for a moment, there's a natural and I think limited window after a moment where preparedness seemed lacking, where we can make substantial progress. We need to acknowledge the limit that we are presented. And the third point is that we need to focus on the right things. So those are the 3 major points I want to make. Let me elaborate on each one. Over the last several weeks, I've been full of reflection. I've been thinking about the times when I was Secretary of Health in 2005 and 6, and it was during the time when our nation was vulnerable to the H5N1 virus. And together with many of you on this call, we went to the Congress and we asked them to appropriate money because it was clear our country was not prepared. The Congress appropriated what felt like real money then, $7.1 billion, and we spent 3 years frantically going about saying there's going to be a pandemic. My colleagues used to tease me that I was the Paul Revere of pandemics. But we invested billions of dollars into vaccines and facilities. We gave money to states and communities. We went around the world building networks of laboratories and cooperation. We held summits in every state. We wrote plans. And the truth is, we did a lot of good. It came back to help us when H1N1 came about and when Ebola. Those are just examples where technologies that were developed during that period were used in protocols. We made significant progress. However, roll forward 10 or 12 years later, and we confronted the SARS-CoV-2 virus, it became evident that we had lost our momentum at some point along the way. And why was it? Well, it turns out that a nation of 300 million people has a lot of priorities. And it's a complex place. There are layers of government, there are competitive interests, there are competing values, there are ideologic and political divisions. It's just hard to maintain the momentum. I'm reminded of an experience I had as a younger person. I was watching television on a Saturday afternoon in between two major sports seasons, and ABC Sports was on the wide world of sport. And they had a lot of unusual competitions to fill up the time. One was a surfing contest. And the commentator was explaining the way this surfing contest worked, and he pointed the camera into the ocean, and he could see people bobbing in the ocean. And he said, notice that they are looking out to sea. And the reason for that is they have to pick the wave, because if they get the wrong wave, no matter how adept they are at manipulating their surfboard, they will never get to the beach. I would suggest that that's exactly where we are in terms of preparedness. We can make some substantial progress while human nature is on the side of preparedness. That is to say, the risks are right in front of us and we're aware of that. But history demonstrates that that doesn't happen or last long. So we need to act. And so my third point was that we need to be assured that we are looking at the right things. And we've talked about many right things today, ranging from large things to smaller things. Again, another metaphor. When I was doing public service in the place I lived, there was a large grandfather clock. This clock was not functional, and we brought a repair person in. My daughter was watching, and he invited her to understand how the clock worked, and he showed her how there were a series of gears, big gears about the size of a bike sprocket down to those about the size of a dime. And he said to my daughter, try to move the little gears. And she tried to move the little gears and said, they're all stuck. I can't do it. It's too hard to move them. He said, well, move the big gears. And she grabbed a hold of the largest sprocket and turned it. And sure enough, all of the little ones started to spin. I'd like to suggest that we have to focus on the big gears in this limited time that we have to drive change. And here are the things I believe make up the big gears, those things that will make all the smaller matters turn in unison in a coordinated way. The first, I totally agree with Secretary Danzig. We have to focus on an all-risk preparedness. We cannot fight the last battle. Now, I'd like to suggest it would be thoughtful for us all and think there'll never be another pandemic, but there will be. There always has been. But it may not be soon, and it will be easy to lose momentum. So we have to prepare for all risks, because preparing for a bioterrorism event is not all that different than a winter storm, or for that matter, a pandemic event. The second big gear is that biopreparedness has to become viewed as part of our national defense planning and our economic planning. If we have learned nothing else during this period of great disruption, the trillions of dollars that have been cost to our economy and to our citizens because we weren't prepared should demonstrate without question that we now have a need to prepare always. And it needs to be viewed as though it were part of our national defense and as a part of protecting the integrity of our economy. The third big gear in my mind is that we have to continue to invest in science, and we need to build those budgets into our existing science budget. During the time I reflected earlier, where we were investing in the science, the mRNA technology that became so vital to warp speed to be able to see those vaccines develop because we were investing in technology. In the last couple of years, we've seen Ebola. That vaccine did not just emerge. For years, people were laboring in labs, and lab directors were taking little bits of money to apply to nurture it along. we constantly need to be investing in the science. That's big gear number 3. Big gear number 4, harvest the lessons learned in a way that we can incorporate it going forward. We've talked at length about warp speed. That will be progress lost, not if we don't have it for the next pandemic, but if we don't incorporate those in the regular process of having drugs approved. There were lessons learned. And if we have to go back and redo the process every time there's an emergency, we need to take the lessons we learned and incorporate it in the ongoing process of regulatory refinement. And finally, we spend a lot of time during this emergency, and I might add every others, working through what is the division of labor between states and the national government. We need to refine it. Because we can solve those issues while there's not an emergency. So my big 3 messages: 1, we're going to struggle as we always do. History tells us that we will struggle to maintain an interest in preparedness. We need to move forward while we have the attention of the American people. Number 2, that window will not last long. We need to move forward in a united way, and organizations or meetings like this help us refine it. And lastly, focus on the big gears. So Jay, that would conclude my summary. Thank you for your inviting me and all of us to participate in this very meaningful discussion of our need to prepare.
Thank you, Governor. And now I'm going to turn it over to my fellow MITRE officer, Beth Meinert, to close us out. Beth?
Thank you, Jay. I just have a few closing remarks. I especially wanted to thank Governor Leavitt and all of our esteemed guests for their wisdom and the conversation and the robust and productive conversations that we had throughout the day. We'd like to invite the audience to continue this conversation with feedback and comments on both the MITRE's 10-point plan and the White House Pandemic Preparedness Plan, and both are linked in the chat. Everyone attending will shortly receive a follow-up survey, and we welcome your further dialogue. In addition, if you asked a question today and we were not able to answer it during the event, please email it to the email addresses that you see listed on the screen at this time. A reminder that MITRE is hiring, and please contact recruitinghelp@mitre.org for more information if you would like to help us on this topic as well as many others. Our next Power Hour will be November 18th at 4 p.m. and we'll be talking about MITRE's new Blue Tech Lab. It's groundbreaking on November 10th and how we will shape the national investment and why it's important. Registration for this event will open soon. Thank you and good night.